Does a hospital trip for the elderly do more harm than good? Let's talk about it. In this video, I'll discuss why taking someone to the hospital can sometimes be more harmful than helpful. I am specifically talking about an elderly patient in this video. Let's talk about all the scenarios as to why you might take your elderly loved one to the hospital. This is something I see all the time as a healthcare worker. You wake up in the morning and your elderly loved one seems more lethargic than normal, isn't really hungry, they haven't really been eating or drinking the past couple days. You've noticed that they're a little delayed in talking to you or a little more subdued. All these things can be really alarming and makes you want to take your loved one to the hospital. Now, by all means, I want everyone to do whatever they want and whatever their healthcare provider says, of course. But I feel like we need to think about the risk versus the benefit and which one outweighs the other. Problem number one with taking your loved one to the hospital, specifically if they're elderly. Hospitals cause deconditioning. Now, it's no one's fault. It's just the nature of the beast. I used to work in the hospital. I saw it on a daily basis. When you're in the hospital, you're mostly in bed and your body deconditions, weakens, loses muscle mass like that. I'm talking in a couple days, your loved one who was up walking around doing all types of things for themselves suddenly has a hard time standing up. Next thing you know, when they leave the hospital, they have to go to rehab, they have to get PT, they have to be rehabilitated. So deconditioning in the hospital happens very quickly and almost always. Also, if you go to the ER and they actually admit your loved one into the hospital, a lot of times they will develop delirium. There is something about elderly people being in the hospital that causes them to be confused. So if they were already confused, even more confused. I saw so many of my patients get delirium in the hospital, which just looks like agitation, confusion. You know, you're trying to talk to them, but they're not really there. They're constantly trying to get out of bed, which guess what? Causes falls, which then causes even more issues. There's always sleep disturbances in the hospital. There's things beeping. There's people walking around. Nurses, by no fault of their own, are coming in the middle of the night trying to wake you up, making sure you get your medication so their sleep gets off, which is probably half the reason why they get delirious. A stay in the hospital doesn't necessarily help the person. You're doing it for good reason. Maybe they do have some issues. They were a little dehydrated or they had a UTI, so they had to get admitted to get that fixed, but now they leave the hospital and they are deteriorated, so they're weak. They're confused, and it takes them at least a week to kind of bounce back once they're home. I'm sure even as I'm saying this, people are listening going, yes, that's happened to my loved one. So again, you have to weigh the risk versus the benefit of being in the hospital. Number two issue of taking someone who's elderly to the hospital. Hospitals overtreat. Period. Period. It's a good and a bad thing. I think if someone's young and healthy and something happens to them and they go to the hospital, it's great. They go there, they get fixed, they don't have many issues because they already didn't have many issues. If you are elderly and you already have a bunch of comorbidities, you take them to the hospital is going to fix the first and most prominent problem, right? So if it's a low blood pressure, they'll pump them full of fluid and maybe put them on a blood pressure medication and the blood pressure will go up. But the fluid's going to hurt the patient because they have congestive heart failure and can't really handle the fluids. Then the hospital has to play catch up with giving them a lot of fluid. So there's a lot of overtreating because that's, again, the nature of the beast of being in the hospital. They don't usually look at the person as a whole. So they're not taking into consideration that they're dealing with an 89-year-old who has other issues besides low blood pressure. So it can cause a lot of issues, which can cause someone to be admitted into the hospital and kind of get into this vicious cycle and maybe never leave the hospital. Again, no one's at fault for this, but if you don't work in healthcare, this is not something you think about, which is why many people do take their elderly loved ones to the hospital. They also will do unnecessary procedures or procedures that maybe they shouldn't do to someone who is elderly. A common example of this is someone 95 years old, falls at home, breaks a hip. Now that is awful. And someone shouldn't have to live with a broken hip, but sometimes doing a hip surgery because you broke your hip is so much more detrimental to the 95-year-old. They have complications because of it. They're bedbound for a long time. They may die sooner because of the procedure because they couldn't really handle it. Anesthesia is a big deal. And in someone who's 95 has a lot of things going wrong with them already because they're 95, they may never be the same person because they had anesthesia. Right? So it is a toss up. And again, I am not your medical provider. So you always want to talk to your own medical provider. But I think it's important to educate about the big picture so people can see what they're really dealing with. Sometimes fixing that hip is not the best option. Now, I will later on in this video talk about, okay, well then what else can we do? I will talk about that because there has to be an alternative, right? And there is, which we can get into. The third issue is polypharmacy, which just means a lot of medications added on board. So usually if someone's elderly and has a lot of comorbidities, they're going to come into the hospital with a lot of medications, right? Sometimes the hospital will order all those medications and give them. Sometimes they'll leave some off or add more so they're not on their regular meds that they've usually been on, or the hospital will add even more medications or multiple kinds of different medications, and that can just be a lot for the person and also cause a lot of side effects because they're on all of these medications. So over-medication can always lead to falls, confusion, changing medications up, taking someone off a medication they've been on for years and starting a new one. It all can be a lot for a body, for a system, and is harder to do with someone who is older. When someone's body is getting towards the end anyway, no matter how healthy they are, it puts a lot of stress on a body to be on medications, off medications, on a lot of medications when they're not really eating. It can cause upset stomach, it can cause constipation, confusion, just a lot of issues. And you have to ask yourself, why? Why? Again, back to that question, risk versus benefit. Number 4, and to me, this might be the most important one. I don't know, they're all important, but this one's really important that a lot of people don't think about. Infections. Nothing against hospitals. I worked in them for years and they're an amazing place and it helps many people. But hospitals are infection causing places. We do our best to keep everything clean, but it is very easy to get a hospital acquired infection. And those things can be nasty. And if you're an elderly person who already is not well, you get one of those infections and it can be devastating. The big ones are C. diff, MRSA. Those infections are really big. And then you can get septic, which means you get an infection in your blood. And then you're really sick. Hospitals are not necessarily the best place for someone who's already really at risk, right? You're already really at risk, you're elderly, you have a bunch of things going on, and then you get a really bad infection or you get something like C. diff. C. diff is something that will make you have really, really bad diarrhea. And then you get dehydrated because you have really bad diarrhea. And then the antibiotics they have to put you on to help with the C. diff can make you really sick. It's just so difficult sometimes. And again, I keep saying this over and over again because it's something you have to think about, is the risk versus the benefit. Like, was it really worth it to go into the hospital because your loved ones seemed confused? Hospitals also take away your autonomy. So they take away, like, when you wake up in the morning, when you go to bed at night, when you eat, what you eat, how much you eat, when you take your medications, all of your autonomy is lost. So you have to be doing what the hospital needs you to do. And that is hard on anyone. You're not in your own bed. You're in this hospital room. Sometimes you're with a stranger, and the next bed over, there's beeping, there's yelling, there's, it's just chaotic. And you can't eat what you want. You can't sleep when you want. So losing that autonomy can be hard on anyone, and then really hard on someone elderly. And then last but not least, the cost of it all, right? One, it can be expensive. And the emotional cost of having to go see your loved one not wanting to be in the hospital, trying to get them out of the hospital. Once they get out of the hospital, are they too deconditioned to go home? So then do they need to go to a rehab, which is also really hard. So all of these things I like to bring up and bring awareness to them so people can think about what they want to do. So let's get to that now. Let's talk about what else can you do? How can you plan for this so you don't have to take your loved one to the hospital? There are options for you. The first and most important one, I think, is to get a family doctor who you really know, love, and trust. That can be hard to do sometimes. And they're not always going to be on call, obviously, because it's a doctor's office. But to have a doctor that you see pretty much on a regular basis, or you have contact with, even if it's just via telephone or via a Zoom call, will be helpful, because if your loved one starts acting funny on a Tuesday night at 11 o'clock at night, when doctors aren't available unless you take them to the ER, oh, I can call Dr. So-and-so in the morning and see if they can get us in for an appointment, or at least talk to us over the phone, right? Or say your loved one has a fall over the weekend, they seem okay, they're still walking and talking and they can get up. Maybe you can say, okay, we'll watch them until Monday when we can call Dr. So-and-so to see what we should do. So having a family doctor that you know, love, and trust, that you can call during regular business hours, so you don't have to take your loved one to the ER for something like a change in their mental status, or maybe they have a UTI because their urine's smelling a little stronger, things like that. 2, I say this all the time, plan. Have a plan in place, meaning know what your loved one wants. If your loved one suddenly does have a changing condition, but they're 95 years old and they've said to you, I don't want to go back to the hospital, what are you going to do then, right? Because you already know they don't want to go back to the hospital, but they did have a changing condition. Knowing what they wanted, right? Knowing that they wanted to stay home. If they are comfortable and nothing seems wrong except for they did have a changing condition, there might not be anything for you to do except for you to call your family doctor that you know and trust, right? And say, hey, they've had a changing condition, but they say they don't want to go back to the hospital. Can you refer us to home health, palliative care, maybe hospice? That can be done. That is legally allowed to be done, as long as you guys all know that's what your loved one wanted, right? No one's going to force you to take them to the ER, specifically if you know that your loved one doesn't want that. So that's why it's so important to plan. So the burden doesn't fall on you and you feel bad for not taking them when they've had a changing condition. Does that make sense? It's like planning ahead, talking about this stuff. So if your loved one does have a changing condition, hey, they have already told me they don't want this. So it's really important for you guys to talk about it now and plan for that as if it's going to happen, so you know what to do. Or if your loved one can even say, if I am ever elderly and fall and break my hip, do not let me go to the hospital, do not have me have a surgery. That is okay. So many patients on hospice come on hospice because they were elderly. They have some things wrong, and now they have fallen and broken their hip, and they choose not to go to the hospital. Sometimes be put on palliative care, sometimes even hospice. Basically be on hospice or palliative care until you die. You don't have to get your hip fixed, and they can make sure that you are still comfortable and okay. There are many ways for you to treat your loved one's issues, meaning like, let's say you think they may have a UTI, or they are not eating as much, or they are a little more confused than normal. If you already have a plan in place, meaning like you know that this may happen because you understand the disease that they have, you don't necessarily have to take them to the ER every time this happens. You can have a plan in place, talk to your family physician. You can start talking about hospice, talking about home health care, palliative care. There are different options that you can get more help in the home when you see your loved one possibly declining or changing over time because of their disease and because of their age. Each family needs to make the best decision for themselves, but it's so important to know the information. The more you know, the better you can care for your loved one.